Heart failure is a common chronic condition with serious consequences. Despite its negative health impact, current primary care-based heart failure diagnostic approaches are time-consuming and imperfect. As a result, patients with heart failure can go unrecognized during early stages, a point at which treatment interventions are cheaper and more effective. Before surgery, however, healthcare specialists come together to intensively evaluate a patient's fitness for surgery. The team's goal is to identify previously undetected high-risk diseases such as heart failure so that these diseases can be treated before the operation. Still, the challenge with heart failure is that it impacts different patients in different ways. Because of its subtle and varied disease progression, its diagnosis is precluded by any single inexpensive and reliable test. This problem is compounded by the busy workflow of a pre-op clinic. Unfortunately, in some cases, subtle clues for heart failure, which are distributed across a range of data sources, are incompletely put together by the busy pre-op clinic team, and an opportunity to diagnose heart failure is missed. However, emerging data science techniques, capable of quickly and efficiently harnessing vast arrays of diverse data sources, offer an innovative solution to this problem.
We propose to develop the Surg-e-Screener HF tool, an intelligent AI-based heart failure screening tool which tackles this problem in two ways. First, the heart failure screening tool uses machine learning algorithms which leverage data collected during a pre-op evaluation in order to detect patients at high risk of having heart failure. By flagging such patients, the constrained resources of the busy pre-op clinic can be allocated towards the further evaluation and testing of these patients, and away from the costly and unnecessary testing of patients unlikely to have the disease. Second, we will reinforce the algorithm with computable recommendations for heart failure evaluation and management as drawn from national consensus guidelines. Through an intelligent clinical decision support tool which can be automatically embedded into the electronic health records, computable recommendations can be integrated into the clinical workflow.
50% of the project funding to purchase servers and data storage, and the remaining funding will be used to support faculty effort and research time. To promote the heart failure screening tool, we will engage necessary clinical stakeholders and draw upon the collective expertise of a diverse, nationally recognized team of anesthesiologists, cardiologists, and data scientists. We will use an existing data set of expert-reviewed patients with and without heart failure to train the Surg-e-Screener HF tool. We will then use existing techniques for processing clinical data in the electronic health record to organize and present evidence-based recommendations for heart failure diagnosis. We expect the tool to benefit patients and families through more effective evaluation and management of heart failure and through improved cardiovascular outcomes following surgery. We also expect the tool to benefit clinicians through an opportunity for on-the-job training among clinician learners providing heart failure recommendations. By minimizing the evidence-to-practice gap in pre-op care, this Surg-e-Screener HF tool shows how clinician and data scientist team members can be the leaders and best in providing patient care.